Hello, my name is Dr. Nicola Pemberton, and I'm the medical director of the Birth Center in New Jersey. I started out in OBGYN, which is what I am. But prior to graduating from medical school, I had an opportunity to study in England and study among the midwives and get to see things how it was meant to be naturally, and also see how sometimes the midwives were upset with the physicians on how they tend to muddy up as far as they're concerned the natural birth process. But it also comes full circle with my grandmother. She was also a community-based midwife, but back in her home country. In that regard, I guess it was, you could say, in the family. During the time when I was in OBGYN, I was trained in the hospital system. I really didn't have the natural birth mindset at that time during my training. But once I graduated and was working after I completed my postgrad residency, I found myself given the opportunity where women can be able to just labor on their own, in their own time, and it just kind of grew from there. But things always change in life when you're a professional to when you become a mother yourself. And having been a patient, realizing it on the other side as a patient, and especially as a woman of color in the hospital system, I was able to appreciate it personally. I've always been sympathetic with my patients, but the empathy really took on a whole new realm when I became a mother myself. In that moment, I realized we could definitely do better as physicians in medicine. And it's not a criticism to the medical field. It is just something that says whatever we should do and whatever we can do, we should always strive to do better. Unfortunately, with the natural birth realm, many times it always would be looked at as something as an outlier, where only certain type of women would consider this choice. Sometimes we'd even have comments that say, you're not getting any special prizes for having a baby without an epidural, just take the epidural. There are many times it would be the stereotypes of only women who were crunchy granolas. The term is used constantly regarding who would consider to have this type of natural labor or delivering. And I had to be educated on that a little bit, even as I was researching with the desire to open a birth center and a space where we practice midwifery model of care. It doesn't matter where we choose to practice that. It doesn't have to be in the birth center. It's something I would fight for my patients if eligible in a hospital setting, regardless of where they have to deliver. If they're eligible for it, we want to fight for that. In light of that, it kind of kept coming together. And I was being educated and I was learning in the process, whether it be from other midwives, whether it be from doulas, home birth midwives, regarding how this process can really improve and how more of us as physicians should be a part of this process to give our women choices, empower them to have lower risk births, especially if they're eligible for it, whether they're in a hospital or birth center setting or a home birth setting, and be able to support that, not frown upon it, not stereotype it, not create a cliche about it, actually support it. And so that's how this all came to be.